Hello everyone, my name is Dan. I'm from Woodpecker Medical. So today we have invited 3 outstanding experts for dental laser. So later on, I'm going to give them a brief interview. So let's have a guess. Who is going to be the first person to be interviewed? So he's an award-winning clinician and founder of Smile Orchard, a renowned dental practice regional training center in Bristol. He's a Master's of Science graduate in implant, oral surgery, and laser dentistry from 𝐓𝐀𝐋𝐊 Aachen University, Germany. He is an international recognized authority in laser dentistry and a frequent speaker at Global Dental Forum. He is a recipient of a prestigious Prof. Norbert Gastner's Research Award for Innovation in Laser Technology. Let's give a warm welcome to Dr. Koushik Naik.
Hello.
Welcome. Hi, Dr. Koushik. So today the first question will be, so in your clinical experience, do you view laser technology as an essential tool or more of a nice to have? So please explain your reasoning.
Okay, so laser technology. It's a bit of an unheard space for a lot of dentists in the present situation. But let's go back to the basics. What are the main issues we in the dental fraternity are having on our day-to-day practice? We are having a lot of issues when it comes to pain management. We are having a lot of complications when it comes to inflammation and infection, as well as we would always love to see, is there a way we can stimulate tissues to heal better?
Okay.
Because if these 3 things can work in a nicer way, that would have a great impact on how our treatment protocols can be refined in a very nice way, where the patient management and the patient experience could be enhanced.
I see.
So traditionally, we have always been looking at pharma as our go-to process, and unfortunately, the amount of results we have has very limited amount of success.
Yeah.
And as we go forward, we see in healthcare, you're trying to be more holistic, you're trying to be minimally invasive, and you want to be very, very biostimulative when it comes to tissue healing. So the overall experience for the patient and the complications they face is minimal. When you look at your options, you do not have a better option than integrating laser into your traditional treatment protocols and methodology.
I see.
And that's the reason why it is something that you got to take very seriously in your training as well as your implementation in all your dental and oral procedures. So you are actually not making a major shift from your traditional methods, but you're trying to add on another procedure or another technology which would enhance your traditional treatment protocols. So I would say it's an absolute necessity for every dentist to be able to get into it, understand it. And I see the challenge here because a lot of the dentists, since they haven't been educated or trained in light physics, it is a completely new arena of learning. It takes a bit of jumping and dwelling into, but that is the need of the hour, and I would say it's a very, very, very necessary aspect of your oral health care in today's state.
I see. So overall, I think Dr. Koushik thinks that the laser is a necessary unit for oral practice if we can do the right education. Yeah, thanks for the explanation. So the second question will be, what clinical advantages have you observed with the dental assisted disinfection compared to the traditional method?
Okay. When it comes to, let's split it up into say endodontics or periodontology or oral surgery. In all these aspects, we are constantly facing certain challenges in terms of disinfection. In endodontics, all traditional methods have been tested and tried, and the only way we are trying to disinfect a root canal is by using chemical irrigants.
Right.
And there's huge amount of research out there showing chemical irrigants are not effective enough to penetrate through and through the dentinal tubules.
Yeah.
And because of that, the infection decimation is very limited, and so we are looking at a kind of a low level toxicity left within the tooth even after your treatment is complete. So what is the solution?
Okay.
The solution here is a laser treatment, which will, in a way, with all literature that we have today, show there is a complete disinfection chances very, very much better than your traditional ways. To give you a comparison, your traditional way of disinfection is about 8%.
Yeah.
Your laser assisted disinfection is about 99.99%. That's a massive, massive difference which you cannot ignore.
Yeah.
And the same thing happens with periodontology. With periodontology, it's not only with disinfection, but it also is assisting you in biostimulation hand in hand. Right? Because with antibiotics, the biggest complication the world is facing right now is the resistance for antibiotics for people who have been constantly given antibiotics for multiple reasons, and we are trying our best to minimize it. And the only way you minimize it is by using lasers, because laser doesn't have any kind of a resistance associated with it. You can use it 200 times and there is no impact on the patient negatively. The same thing with oral surgery. You can be very selective in the way you can create disinfection compared to your traditional methods. So this goes on and on and on. It's such a massive subject, but once you get into it, you understand how selective and how precise you can be in what you want to achieve. So disinfection with laser, it's an absolute wonderful change to what traditional methods we have been using.
Wow, thanks for the insight for this. Okay, and then the next question is, say, currently in the market, there are several different kind of lasers, such as 290, 40 nanometer, the 𝐲𝐸𝐾 laser, 2780, the Waterlase, 10,600, the CO2 laser, and also 810 to 980 diode laser, and also we have the 450 blue laser. So what do you think, maybe regarding the clinical effectiveness, the ease of use, the cost, and the patient outcome? So what advantage do you see in our blue light laser?
Okay, let me put it in a different way. I'll give you an analogy. So when you talk about doctors, you have a general doctor, a general medical doctor, you have a cardiologist, you have a nephrologist, you have an endocrinologist. So they all are doctors, they all know subjects of each other, but they are very specialized in a particular section of that medical field. So you compare that to lasers, all the wavelengths that you're talking about are basically specialities of the same laser spectrum. And each of them have certain advantages which the other one probably lack or not have to that level of precision. And so each wavelength is amazingly useful in certain aspects, and they do certain activities of the other one, but they are not probably as precise as the other one. All right? So what the Woodpecker blue laser has done is, within the visual and the near infrared spectrum of lasers, they have brought in 3 wavelengths which have been spread within that parameters and are being very effective in creating a great environment for a clinician to use 3 different wavelengths in areas where there are specific needs. Compared to some of the traditional laser machines where there's only one wavelength, so you're having one doctor having to treat everything, whereas you have 3 different doctors of 3 different specialties in one machine, so you're able to pick and choose which one you got to use and how you want to use it.
I see. So blue light laser give you more option than the other.
So when you talk just about the blue light laser, which is your 450 nanometer laser, it is a laser which is, we call it as a cold laser, because the penetration of a blue light laser is much, much deeper, because the absorption of the laser is only in hemoglobin and pigments. It doesn't get absorbed in water. Because it doesn't get absorbed in water, it is not heating up the tissues. So the other option for surgery in soft tissue is probably, say, a 976 nanometer laser, which has absorption in water as well.
Right.
So if you really want to have a very clear, precise incision or a cut, you would rather use a 450 nanometer laser because it is not heating up the tissues.
Right.
It is not then causing a lot of heat-related trauma to the tissues, and it has a much precise way of surgically incising the tissue compared to a 976, and that is why it's become so much more popular in superficial and deeper soft tissue surgeries.
I see. So the blue light laser maybe has some advantage in the soft tissue cutting.
Yes,
surgeries.
surgically it has now been shown that it has a much better cutting efficiency and much better tissue management efficiency compared to your traditional lasers like the 976 and the Nd:YAG laser that we used to use in the past.
Got it. Okay, thank you.
You're very welcome.
Okay, so maybe the interview with the doctor has come to the end, but now we have a maybe special event because during the Facebook, we have several questions raised on the doctor. So right over here, I have all these questions for you. So you can pick up one of them randomly. So if the doctor, maybe the questions get picked from you, they also get a gift.
Oh, yeah. All right.
Please get one.
I'm sorry if I haven't picked your question.
Yes.
Okay, so what is the question?
Yes.
What are the current evidence-based advantage of using diode laser in root canal disinfection compared to traditional irrigation technique, and how does it impact long-term endodontic success rate? Great question, and this is one of the questions that has been discussed a lot in the scientific field as well, because one of the biggest debate that is going on in endodontics is root canal treatment a valid treatment at all? This has been the basic question. Okay, because in some of the countries like in Switzerland, they are more or less trying to think if endodontics should be completely abolished. Okay, because with all the evidence that they have been having, it's almost impossible traditionally, using traditional disinfection methods to disinfect a tooth completely with your chemical irrigants.
Right.
So if you're not able to disinfect the tooth completely with your chemical irrigants, you are leaving a kind of a low-level toxicity embedded within your tooth. So there's some amount of toxins, some amount of bacteria that is present in the lateral dentinal tubules, which is left in the tooth. The question then is, okay, so why is it not causing any problem to the patient? It's not causing any problem to a healthy patient because the immune system of the patient is able to ward it off. It is not allowing that low-level toxicity to impact the overall health of the patient. But the impact is at such a low grade that we as human beings are not able to feel it. But the minute a patient or a person who has endodontic treatment has some amount of immunodeficiency. It could be either because of certain treatments that we would have to do. For example, if you're having to do radiation therapy on this patient, which goes in the direction of the tooth, the oncologist would ask us to remove that tooth which has been root treated to a very great precision because they see it as a low-grade infection. Right? And that is the whole debate. So what is an alternative? And this is where laser has come into a great discussion because a lot of in vitro studies that we have shows that you are able to use laser to penetrate through and through the dentinal tubules to have complete disinfection of these root canals. And the studies show the difference is massive. So when you're getting around about 8% disinfection with your traditional method, you are able to get about 99.99% disinfection when you're using laser as an adjuvant. So the overall outcome for the patient is massively increased. And so with all the literature, with all the evidence, as well as case studies that we have been consistently seeing, it is considered to be a great practice to be using laser as a tool in disinfecting root canal treatments along with your traditional biomechanical precision methods of cleaning.
I see. Yeah. I see. Yeah, would you mind I add another question? Yeah. Actually, because currently I'm mainly responsible for the North American market, and over there, did you know the Agendo they launch a laser for the irrigation? So what you think? What's your idea about laser for irrigation?
See there are two things that you're focusing on when you're looking at endodontic disinfection. Number one is you want to clear up the smear layer, okay? And that's one of the challenges, whether it's a cavity preparation or it's a root canal biomechanical preparation. When we are using rotary instruments, we tend to build up smear layers, okay? And when you have smear layer within a cavity or within a root canal, it blocks the radiation of your lasers to penetrate through the dentinal tubules. And so the laser that you're using for disinfection is not as effective as it should be. So what is a way to wash out the smear layer? So we are using a lot of different things. We are using EDTA, we are using ultrasonic instruments, and we are using lasers. So when you're using lasers for irrigation purposes, your whole idea is to create a kind of a cavitation action within the dentinal tubules. It's like a washing machine effect within the dentinal tubules with a bit of an increase in temperature of the water, because these lasers, especially the 𝐓𝐀𝐿 laser, it has good affinity for water, so it does heat up the water, and also it creates that bubbling effect, which helps to enhance that smear layer removal process within your dentinal tubules. So that combination is considered to be the most effective. So you have cleaned your root canal treatments in your biomechanical preparation, then you have used your irrigant along with your 𝐓𝐀𝐿 laser to get the cavitation effect for your smear layer to be removed, and then you use your 976, which is probably the most preferred laser these days, once the canal is dried, to create disinfection, and then once you've created your disinfection, you go for your obturation.
Gotcha. Yeah, thank you. Okay, thanks for Dr. Koushik Naik's the answers. Thanks for that.
It's a pleasure. Thanks very much.
Thank you.